Hi, my name is Negeen, and it's my pleasure to walk you through what we offer here at PharmAchieve in our OSCE courses. In the PharmAchieve course, we have various tools and resources to help you understand what's expected the actual day of your OSCE exam, what competencies you're faced with, what questions you should ask, what questions you should not ask, how do you approach the stations, and most of all, how you can be your best self the actual day of the exam. We're going to explore the different ways you're assessed, and most importantly, through our formats of the course, provide you individualized feedback to see what it is you're struggling with, what you're having trouble with, and how we can make suggestions for you to best be able to solve the stations when you're in the actual OSCE exam. We have 3 different formats for you to choose from, so you can do whatever works best with your schedule. We want to optimize your ability to individually practice and perform as much as possible. So through these different formats, this gives you the ability to do that. I'll first explain our long-term course. In the OSCE long-term course, you can pick from various dates and times that will meet once a week over the course of 8 weeks. Once you confirm your choice, you're going to be paired up with an assessor as well as a standardized patient and a small group of students to practice select cases that give you the skill and ability of how to solve cases in the OSCE, so that no matter what you're faced with, you know what to do come the day of your exam. So that's a slow, steady pace. If you like to kind of start early and meet once a week, then that's a really great option for you. Another option we offer is our short-term course. In the short-term course, it's a little bit more dense, so if you prefer to kind of block out a couple days where you want to spend the full day practicing, again in small group settings with an assessor, with a standardized patient, then this can be a good option for you. We also, for those of you that are in Toronto or can be in the Toronto area, the option to do the small group settings in person in our office, again with the assessor as well as standardized patient. In all 3 options, you are provided with full access to our Qbank, which has various tools and resources from home practice cases, non-interactive cases, coverage of minor ailments, professional judgment, some sample videos, games, and a lot more we're going to cover coming up. Also, an important thing to note, with any of the options you choose, included in any of these packages are the mock exams. So you get 2 mock exams on the same day included in any of the options that you choose. And all of this is designed on purpose to give you the tools to be able to practice, be polished, be your best self, so come the day of your mock exam, you're ready to go for your actual OSCE exam.
Hi, I'm Monica. I'm one of the instructors at PharmAchieve, here to provide an overview of your course. In your classes, you'll be paired with professional actors and experienced pharmacists. You will work through cases in small groups, rotating turns, and using a 7-minute timer similar to what you'll experience in your exam. Your actor will play all kinds of roles, including your standardized patients. Your pharmacist will review your performance using an assessor form to help you understand the expectations of the case, identify any strengths or any areas of improvement. They will also review the clinical reasoning behind your case so that no matter what scenario you face, you will have the skills to achieve the correct outcome.
The thing is, on the exam, they could throw anything at you. They could throw you like a really, really unfamiliar reference that's very hard to read, or you just have to deal with like what is in front of you. So just take a few moments to like properly review it. I think in this reference as well, it said that there is a very low chance of cross-reactivity between cephalosporins and penicillins, and therefore the correct conclusion was to still dispense the cefalexin and then go further and say, we can monitor you in the pharmacy or counsel the patient on these allergy symptoms. If you experience any of these, then you need to stop. So yeah, I would also say to know the difference between cephalosporins and penicillins, and that was in your reference. And because it's an infection, usually we try not to delay treatment as much as possible. If it was a more severe reaction that you quite clearly needed to change the medication, then you could offer to phone the doctor right now, for example. It depends on the case and the reference you have, but this one, it did say that there's a low risk of cross-reactivity in your reference.
Okay.
So overall, I think you did a good job. I think just adding a little bit more detail, I think would be really beneficial in your counseling. Now, at the 5-minute mark, we asked you earlier, what can I do if the patch falls off? If you're not sure, don't jump to an answer. Look in your reference first if you have an answer. So in your reference, it discusses very clearly what to do. So you told them that they can just reapply a patch. That's partially true. It's going to depend on how many days it's been since they've noticed that the patch has fallen off. So if you look at your reference on page 73, if it's been less than a day, they can apply the new patch and no contraception is needed and their patch day stays the same. But if it's been more than 1 day, or they're not sure how long it's been since their patch falls off, they might be pregnant, they would have to actually start a new cycle completely.
In addition to your live practice classes, our goal is to ensure you have all the resources needed to succeed in the exam. Therefore, we have a plethora of material to support your journey. Some of our supportive material includes how to use references, or on topics such as professional judgment. A part of our course is an extensive set of cases that you can practice with your peers. This includes over 200 interactive cases. If you're ever feeling tired of practicing, we have a library of videos that you can watch at your leisure. Or you can focus your time on our set of over 60 non-interactive cases. We also provide resources for minor ailments. Whether you want to learn what the red flags are for a specific condition or how and when to refer a patient, we have it covered.
Hi, my name is Zainab. I'm one of the pharmacist instructors here at PharmAchieve. I'm going to take a couple of minutes to walk you through what to expect from our mock exams and how it can help you succeed on exam day. Our mock exams very closely mirror the actual PEBC exam. You'll be working through realistic patient cases under timed conditions where you'll get to experience the pacing, the flow, and the pressure of the exam before it really counts. During your mock, you'll work through multiple stations that assess key competencies such as clinical decision making, patient counseling, communication skills, and professionalism. Our cases are written by our team of expert pharmacists who really understand what it takes to solve a case, whilst also preparing you for the real world in becoming a confident and competent pharmacist. One of the biggest advantages of our mock exam is the structured and tailored feedback that you'll receive after each station. We'll highlight your strengths while also identifying any areas of improvement. Identifying these gaps earlier on helps you with your preparation more effectively. We also understand that every student has different needs, which is why we offer our exam in 3 different locations. You can choose to attend in Toronto, Calgary, or Edmonton, or you can choose to attend online from anywhere in the world, while still receiving the same high-quality cases and feedback. So whether this is your first OSCE attempt or a rewrite, our mock OSCEs are designed to help improve confidence and reduce that on-day anxiety.